All right, Noah, so we'll go ahead and get started with the physical exam. The first thing that I'm going to do is just take a look at the hair. So I'm just inspecting the hair, looking at the distribution of the hair over the scalp, which appears normally distributed. I'm just going to go ahead and feel the hair. I'm just noting the texture, which feels normal. And then I'm just going to take a look at the scalp, which does not appear dry, no dandruff or flaking, no lesions of the scalp. Any tenderness here?
No.
Okay. And then I'm just going to take a look at the, just at the skin. I'm not noting any obvious rashes, ecchymosis. I'm noting some macules, freckles, which don't look suspicious or appear abnormal. I'm going to just go ahead and feel the skin, and with this, I'm noting temperature, which feels warm, and also moisture, which feels dry throughout, which is appropriate. And then next I'm just actually going to take a look at the nails. So with the nails, I'm just looking for any clubbing or cyanosis, which I'm not seeing. And I'm just going to be pressing down, looking for the capillary refill. Which all is less than 2 seconds, so that's great. The next thing that I'm going to do is just take a look at the head. The facial features appear symmetric. I'm not noting any obvious masses, no swelling. I'm just going to go ahead and feel the head, so I'm going to actually just have you take your glasses off. And so just feeling for any swelling, any masses, which I'm not noting, any tenderness?
No.
Okay. And I am also just going to feel the temporomandibular joint. So just feeling, palpating right here at this joint, any tenderness?
No.
I'm not noting any swelling in this area. I'll just have you go ahead and open your mouth and go ahead and close. Good. No clicking with that. So that's great. Any tenderness with that?
No.
Okay. Next, I'm going to take a look at the eyes. So first, I'm just looking externally here, not noting any swelling of the eyelids or around the eyes, not noticing any obvious redness or drainage or watering. The eyes appear normally aligned. The distribution of the eyebrows appears normal over the eyes. I'm just going to go ahead and take a little bit of a closer look at the sclera and the conjunctiva. So I'm just going to pull down here and have you look up. Good. So no redness, no drainage. The sclera appear white, which is appropriate. I am going to just test your visual acuity.
Okay.
I know you said that you did have a recent eye exam, but we'll just do the Snellen eye chart.
Okay.
The chart that I have is adjusted to be at 10 feet away, so I'm going to have you stand 10 feet away. You should use your corrective lenses for this. You'll cover one eye at a time with a card that I give you, and you'll be standing at the edge of that carpet right there. Do you have any questions?
No.
Okay, so you can go ahead. I'll give you this card. And I'm just going to bring my camera a little closer. Okay, so go ahead and cover your right eye. And looking out of the left eye, can you read line 5?
PECFD.
Okay, can you read line 6?
EDFCZP.
And line 7?
FELOPZD.
And line 8?
DEFPOTEC.
And line 9?
LEFODPCT.
Great. I'll just have you go ahead and blink a few times and then cover the left eye. Can you, I'm just taking a look there. Can you read line 5?
PECFD.
And line 6?
EDFCZP.
And line 7?
FELOPZD.
Line 8?
DEFPOTEC.
And line 9?
LEFODPCT.
That was 2020 in both eyes. You can go ahead and take a seat right back down there. Next, I'm just going to dim this light, and I'll have you take your glasses off. I'm just grabbing my light. First, before I use the light, I'm just going to be testing for any extraocular movement. So I'm just going to ask you to follow the pen light here. Okay. Good. I'm not noting any extraocular movements, which is appropriate. I'm next going to just shine the light into the pupils, and I'm going to have you take a look out into the distance behind me as I do that. Do you have any questions?
No.
Okay. Great. So the pupils are equal, round, and reactive to light and accommodation, and the consensual response is present. I'm just going to go ahead and put this down, and next I'm going to be examining the ears. So first I'm just going to take a look. I also need my other light back on to get a better view. Just taking a look externally here, not noting any obvious masses or deformities of the ears, and no obvious drainage. I'm just going to take a look a little bit closer. No redness, any tenderness?
No.
Okay, I am going to just do a whisper test, so I'm just going, when we do that, I'm going to have you turn your back to me. I'm going to have you cover one ear right here and just rub so you can't hear out of that ear. And then I'm going to whisper behind you and have you just repeat back to me what you can hear. So
Okay.
Go ahead and face this way and cover your right ear and just start rubbing into that.
3, U, 1.
Okay, and then we'll just switch sides.
4, 3, K.
Okay, great. So that was normal. I'm going to just go ahead and look internally into the ears now. So I'll just go ahead and just going to anchor myself here. Take a look. Okay, so the right ear appears to have cerumen or earwax impacted, so I'm not actually able to visualize the eardrum, which can occur, but it sounds like no reduced hearing out of the ear, no pain, just looks like impacted with earwax. I'm going to take a look at the other side. Again, just anchoring here and taking a peek. So this ear appears without erythema. The tympanic membrane, the eardrum is present without perforation and appears gray in color, which is appropriate. Again, no erythema of the canal, no drainage, no inflammation, so that looks great. So I'll just go ahead and put this back down. Next, what we're going to do is I'm going to be taking a look inside just at the nose. So first, just looking at the nose, no obvious masses or deformities or swelling. I'm going to actually need my other light to take just a look inside the nose. So I'm going to have you go ahead and just look up. And so I'm just taking a look here, viewing the septum, which does not appear inflamed, and not noting any bleeding, no obvious polyps. Just taking a look at the other side, which appears similar, no inflammation, no blood, no polyps. I'm going to test for patency, so I'm just going to go ahead and close off one nostril, have you breathe in through the other. Good. And on this side. Good. And then I'm just going to be taking a look inside. Well, actually, first I'm going to just palpate the sinuses. So I'll have you go ahead and just take off your glasses. So I'm just going to be feeling up here above the eyebrows. Any tenderness?
No.
And below, any tenderness?
No.
And I'm just going to percuss. So what I'll be doing is just tapping onto one of my other fingers here. Any tenderness?
No.
Okay. Next, I'm just going to be taking a look inside the mouth. First, I'll have you just go ahead and stick your tongue straight directly out. Good. I'm just noting symmetry there. That looks great. I'll have you just gently open your mouth. So first, I'm just taking a look at the teeth, at the gums. Good. Not noting any obvious signs of cavities. Just taking a look down here. No inflammation of the gums. I'm going to have you just go ahead and say ah. Great. So the uvula appears midline, no swelling or erythema of the tonsils. All right. So what we're going to do next is I'm just going to take a little bit of a look at the neck. So first I'm just assessing for any obvious signs of swelling or masses, which I'm not noting. I'm just going to have you go ahead and look over either shoulder like this and bring just each ear to each shoulder and just extend your head back and then bring your chin towards your chest. Good. Any pain, stiffness, anything like that? No. Okay. So next I'm just going to palpate the lymph nodes. Just looking for any enlargement and also any tenderness on exam. First, I'm just feeling for the preauricular lymph nodes. Not noticing any enlargement here. Posterior auricular and no enlargement. Occipital. Good. Tonsillar. Submandibular and submental. And no enlargement there. I'm just going to feel for the superficial cervical, the deep cervical, posterior cervical, and then the supraclavicular a little bit lower. So I'm just going to open this a little bit in the back and feel here. And not noting any enlargement of the lymph nodes. Did you have any tenderness with that?
No.
Okay. Next, I'm just going to be taking a look at the trachea. The trachea appears midline without any deviation. I'm going to have you go ahead and look up, and I'm going to be just looking for the thyroid gland. I'll have you go ahead and swallow. Good. And I'm not noting any obvious enlargement or goiter by looking at the thyroid. I am going to palpate for the thyroid, which involves just displacing the trachea just slightly to each side, just for doing some palpation. I'll have you go ahead and turn this way. I'm just going to palpate here, and I'm just going to go ahead and displace this over, and I'm just palpating for any enlargement or masses. I'm not noting. Are you doing okay?
Mm-hmm.
Okay, and then I'm just going to go over to the other side. Again, no enlargement there. Any tenderness?
No.
Okay. So next I am going to just be evaluating the lungs. So I'm going to have you again come over. Actually, we'll have you come over this way so that way we can have the camera take a look. I also am just going to get my stethoscope for this. So I'm just first inspecting the posterior chest. I'm just looking for expansion equally, not noting any use of accessory muscles for breathing, not appearing in any type of respiratory distress. I am going to just open this bottom string, and I'm just going to have you go ahead and take a deep inhale and relax. Good. So bilateral chest expansion there. I'm just going to be palpating any tenderness here.
No.
Okay. Next, I am going to use that percussion tool again. So just tapping across the lung fields, looking for resonance along the lung fields. Good. So resonant throughout. Next, I'm going to take a listen. So each time you feel me move my stethoscope, I'm just going to have you take a deep inhale and exhale through the mouth. Okay, just a few more. Good. So the lungs sound clear without any crackles or wheezes. So that's great. I will just have you go ahead and face the front here. So next I'm just going to be taking a look at the front of the chest, doing similar techniques to the front of the chest to evaluate the lung fields here. I'm just going to go ahead and lower the gown. So first just inspecting the front of the chest, not noting any use of accessory muscles for breathing. You appear to be breathing naturally with equal chest expansion. I'm just going to go ahead and palpate for chest expansion. So go ahead and take a deep inhale. Good. So again, that felt equal and normal. I'm just going to go ahead and palpate the chest. Any discomfort?
No.
Okay. So I'm just going to go ahead and use the percussion again, looking for resonance. Very good. So that all sounded resonant. I'm just going to take a listen now. And take a deep breath in through the mouth. Nice deep breath here. Good. Great. So clear without crackles or wheezes throughout. I will go ahead and just have you lie back with the head up here and bringing the feet up. I'm just going to go ahead and dim the light and grab my other light because I'm going to be using some tangential lighting. So I'm just going to take a look here and just assessing for any jugular distension, which I'm not noting. I'm also just going to take a look just looking for the PMI, and I'm going to just go ahead and turn this light back on. And next I'm just going to palpate for the carotid artery. So just feeling here. And here. Good, so I'm feeling the brisk upstroke of the carotid artery. I'm going to go ahead and take a listen, evaluating for any worries. Not noting any burpees. I'm just going to be palpating the front of the chest and just looking for any heaves or lifts here. And the right intercostal space as well as the left. And then just down the left sternal border, not noting any heaves or lifts. Now I'm going to feel with the ball of my hand, just evaluating for any thrills, which I'm not feeling. Okay, and I'm just going to go ahead and take a listen. Actually, I'm going to first feel for the PMI. So we'll just feel my hand down here. Good, so that's mid-clavicular, brisk and tapping appropriately. I'm just going to take a listen. Good. S1 and S2 are present without any extra sounds. I'm just taking a listen with the bell. Good. And no evidence of murmurs here. Next, I'm going to take a look just at the breast tissue. Men can get breast cancer, so it is just important to be aware of that and just be evaluating over the course of your life for any enlarged breast tissue, any lumps or masses, any nipple discharge. I'm just taking a look at the breasts. They appear, the nipples appear symmetrical in line, and I'm just going to go ahead and feel, noting no masses, lumps, enlarged breast tissue, no nipple discharge, and feeling on this side as well. Good. I am going to feel into the armpit. So for this, I am actually just going to have you go ahead and sit up. It'll just be a little bit easier to feel into the armpit here. So just nice and relaxed. Through this arm. Just let this arm hang nice and heavy. You're just going to feel my hand come in here. Just evaluating for any enlarged lymph nodes, which I'm not feeling. Any tenderness?
No.
Okay, I'm just going to go ahead and come down to the other side. So again, just nice and relaxed and heavy as this hand comes in. I'm not noting any enlarged lymph nodes. Are you having any tenderness?
No.
Okay. I am going to just check before we move into the abdominal exam for any tenderness over the kidneys in the back area. Can you just shift this way? So with this, I'm doing what's called a fist percussion. So it's a little bit of a, you'll just feel a tap and you'll just let me know if you're feeling any tenderness. Any tenderness with that?
No.
And on that side?
No.
Okay, good. Go ahead and come back down. I'll have you lie back down. I am going to have you keep this gown lowered. And for the abdominal exam, I'm just going to grab a drape to cover the lower legs here. Okay, So first I'm just inspecting the abdomen. I'm not noticing any bulges, any distension. I'm just going to go ahead and listen to the abdomen first, just looking for bowel sounds. Sorry. And just coming around to this side to listen to the right lower quadrant. So bowel sounds are active in all 4 quadrants. I am going to just go ahead and palpate the abdomen. Just let me know if you're having any tenderness here. Okay, starting with the light palpation, just looking for any obvious masses or lumps, which I'm not feeling. I'm also taking a look at the umbilicus, the belly button, which does not have any bulges or distension. And I'm just going to move into a little bit of a deeper palpation here. Any tenderness?
No.
And I'm not noting any masses, any lumps. Any tenderness?
No.
Great. I am going to percuss the abdomen now. The abdomen is sounding, is having tympany, which is appropriate. And next I'm going to just percuss for the liver borders, which sound dull in contrast to the tympany in the abdomen. I'm just going to have you bring your hand down a little bit. Good. Good. And then I'm going to come up. So I just palpated, percussed the liver borders, which sounded dull, which is appropriate. I am going to palpate the liver now. So one hand is going to become behind your back here, and then I'm just going to start lightly. Good. Any tenderness?
No.
Okay, good. All right, next I am going to palpate the inguinal lymph nodes, which are in the groin, and also feel the pulse in the groin. Does that sound okay?
Yep.
So I'm just going to come in here and just feeling the pulse, which feels 3+, which is appropriate on both sides. Just feeling for any lymph node enlargement, which I'm not noting on either side. I am going to just inspect for any hernias. So I'm going to now have you lift your head up and just cough. Good. So not noting any bulges with that. So next you can go ahead and I'll take this off since it's quite warm. I am going to just be evaluating the musculoskeletal system, which first I'm just going to start by inspecting the joints, noting the shoulders, the elbows, the wrists, not noting any obvious swelling or deformities, and now I'm just going to palpate. Any tenderness?
No.
I'm not noting any swelling of the shoulders. Taking a look at the elbows a little bit more and feeling no swelling. Any tenderness?
No.
Good. And the wrists, any tenderness here?
No.
And through the fingers?
Nope.
Okay, no swelling. Also not noting any redness, no excessive warmth, so that looks good. I'm just going to palpate the hips. Good. Any tenderness with that? And taking a look at, just looking at the knees, they appear in normal alignment. Just going to palpate. I'm not noting any swelling, no redness, no warmth, any discomfort. Taking a look at the ankles, which appear in normal alignment. I'm not noting any swelling. Okay. Next, what I'm going to do is just palpate for the remaining pulses that I haven't felt. So I'm going to just feel brachial, and I'm going to compare to the other side. Those feel equal and 3+. I'm just going to feel the radial on both sides. Equal at 3+, noting the ulnar. And good, equal and 3+. I'm just going to take a feel behind the knee here. And taking a look on the other side. And just going to feel the anterior tibialis pulse on both sides. Equal and 3+, feeling the dorsalis pedis pulse. Good, and then just on this side as well. Equal and 3+. Next, I'm just going to go ahead and have you sit up. And I'll actually have you just go ahead and stand all the way up. Yep, go ahead. And then I'm going to have you face this way. I'm just taking a look at the spine here. I'm going to go ahead and close that. So just taking a look at the spine, not noticing any obvious curvature, in terms of any type of scoliosis or kyphosis, and just palpating here. Any discomfort, tenderness?
No.
Okay. I'm just going to evaluate range of motion, so I'm just going to have you go ahead and extend your spine back towards me. Good, and then I'll have you reach down and touch your toes. The spine appears straight, and then go ahead and come back up. I'm going to have you just bring your right hand down the leg to laterally bend, and then just looking at the spine. Good, and then come back to center and down to the other side. Good, and then come back to center. I'm going to have you rotate the spine here, so I'm just going to have you be making motions like this. Okay. Any discomfort?
No.
Okay. So that range of motion all appears intact and appropriate. I'm just going to have you go ahead and sit back down. Next, what I'm going to do is I'll have you go ahead and lie back down. And I'm just going to have you close your eyes. I'm just going to be touching one part of the body, and I'm just going to have you tell me where you're feeling this.
Right foot. Left foot.
Okay. Next, I'm going to be assessing the reflexes. So I'm going to go ahead and start with the biceps reflex. I'll have you just bring the palm down. Good. And I'm going to be taking a look at the biceps as I do this. Good. And then I'm going to evaluate the triceps reflex. Good. And I just saw that the triceps muscle reacted and responded to that appropriately to strength on both of those. I'm just going to take a look at this other side for the biceps reflex. Good. So noting the response in the reflex and through the arm. Also going to take a look at the triceps on the side. Good. That was appropriate throughout. I'm now doing the brachioradialis. Good. So I felt flexion through the forearm. Good, and again, flexion through the forearm appropriately at a grade of 2. Next, I'm just going to be doing the patellar reflex here. So I'm just going to lift appropriate. Good. Those were 2 plus equal. Lastly, I'm going to evaluate the Achilles reflex. So just bringing the foot up here and just going to go ahead and I'm just going to bring your foot out just a tad bit more. Good. Okay, and then we'll just go ahead to the other side. Just nice and relaxed. Okay. All right. So next I'm just going to be assessing for muscle strength and tone. And just by evaluating any resistance, I'm just going to go ahead and do some passive range of motion with the wrist, and not noting any inappropriate resistance. The tone feels within normal limits. Just going to lift and do some range of motion with the shoulder. Again, the tone feels appropriate. And again on this side, and the muscles appear appropriately defined. Good. And I am also going to test for strength in the upper extremities. I'm going to have you go ahead and clasp onto my fingers nice and tight. Good. And then resist against my hand here. So open, yeah, go ahead. Good. And then just evaluating for strength here, just go ahead and pull against my hand and push against. Good. And then we'll come over to the other side. I'm going to have you push against my fingers. Good. And then clasp onto both fingers. Good. And then pull against my hand and push against my hand. Good. So muscle strength was 5 throughout, which is appropriate, and the tone was also appropriate. Next, I'm just going to be doing some passive range of motion through the hip. Good. Any tenderness there? Okay. Assessing for strength of the hip, I'm just going to have you push against my hands and pull against. Good. And then I'm just going to have you push against my hand here and lift up against my hand. Good. And then we'll do that on the other side. Good. So strength so far for the lower extremities is 5 throughout, which is appropriate. Next, I'm just going to be evaluating for tone by moving the knee joint. So just lifting here. Good. Tone feels appropriate. Good. Next, I'm just going to evaluate strength through the lower leg. So I'm just going to have you bend at the knee and lift up a little bit. And then just pull down against my hand and push up against it. Good. And then we'll do that on the other side. So just go ahead and bend your knee a little bit, pull against my hand, and push against my hand. Good. And then just evaluating strength down here. I'll just have you pull up against my hands and push down. Good. So 5 out of 5 strength throughout the lower extremities. I'm going to have you go ahead and stand all the way up. Facing me, I'm just going to have you extend your arms out with the palms facing up. Palms facing up, great. And then go ahead and just close your eyes. I'm just looking for any pronator drift, which I'm not noting. The hands and arms appear level. I'm just going to go ahead and push down. Good, and the arms quickly lifted back up in line with one another. Next, you can go ahead and relax that. I'm just going to have you do some heel-toe walking, so you can go ahead and do some heel-toe walking just coming towards me. And I'm just going to be looking for steadiness of gait. You can go ahead. The gait appears steady throughout that. And then you can just go ahead and turn back around. Great. Gait appears steady. All right, and that concludes our physical exam. Any questions?
Nope,
Okay,
thank you.
Great. Take care.